We are pleased to welcome back Tom O'Brien, who is the Plymouth County Treasurer, for his section of the news called Treasury Notes. Welcome back, Tom.
Thank you so much. It's always a pleasure to be here.
Always a pleasure to have you.
I always look forward to my segment.
And you have a very jam-packed segment because we're going to talk about pensions and how all the towns and municipalities are going to do pensions for their health insurance.
Correct,
basically.
correct.
So talk to me about how it's done now and how you're going to be doing it differently.
So folks know in a municipality that they're dealing with funding the pensions for municipal workers, but what's new on the horizon is funding for health insurance, and that's called other post-employment benefits other than pension, which is predominantly health insurance.
And it hasn't been funded before?
So in the late 2000s, the Government Accounting Standards Bureau, GASB, came out with a new rule called GASB 45.
GASB 45.
And GASB 45 said to every municipality across the country, you folks must identify what the liability is to provide the health insurance that you're providing to your employees into their retirement for the rest of their life.
Oh,
You have to quantify that number.
How do you do
And
that?
so all of the town, you hire actuaries.
Yeah.
That's how you do it,
right.
really. It's the same way you quantify what the pension liability is.
Okay.
So we're all familiar that we have a pension liability, but GASB 45 came out and said you have to quantify what this OPEB liability is for health insurance.
Right.
And so every town did it, and that study's been done, and every municipality, every level of government, from the state all the way down, can identify what that liability is. And that's all GASB 45 required.
But how do you know 10 years, 20 years into the future what even the model of healthcare is going to look like?
So again, actuaries have studies, they have mortality tables, they understand what the insurance is costing today, and they project out how long people are likely to live. The good news for you is you're going to outlive me. Women outlive men.
Yay!
That's just the way it is. And so they take these studies, and it's all presumptions, and they change the assumptions along the way.
Right.
But based on rules and standards adopted by GASB, that's how they calculate what that liability is going to be. So GASB says you have to assume men will live so long, women will live so long.
Right.
You have to assume that the cost of insurance goes up 4% every year. So they have all these assumptions you have to follow. And then you quantify that liability.
So each town now every year has to have a budget to fund this?
So what happened was once they quantified the liability, now every town knows what it is. GASB 45 didn't go beyond that. However, GASB 67 and 68 came down the road.
Oh, good.
Yes, lucky us. And GASB 67 and 68 said, okay, now that you've identified what the problem is, you need to begin to fund that liability. You need to begin to put it into a trust, which is designated solely for these other post-employment benefits.
Or health insurance.
So it's called an OPEB trust. All right.
But it's really the only thing in that is the health insurance.
The only thing in that is the health insurance.
Okay.
And the only hesitancy is it does include some life insurance. If a town has given its employees life insurance benefits, then that's included in it as well. But it's predominantly health insurance. So now that it's been identified and now that you're required to begin to fund it, towns had two options up until recently. They could do it on their own. They could create an unrevocable OPEB trust on their own, and they have trustees in the town. Or they could join the state fund and invest alongside the state with their OPEB liability.
Which probably makes more sense?
Well,
because it's a bigger pool?
The advantage to the state was that it has a bigger pool, it has a bigger investment team, and the rate of return tended to be better.
Higher, sure.
However, what was interesting about the state option was that you were required to sign a 3-year contract, and you had to put minimally $250,000 each of the 3 years into this OPEB trust.
Just to start it?
Just to begin. And for some small towns, that wasn't really an option. Sure, very expensive. So what I got tasked to do as the Plymouth County Treasurer, our advisory board for the county, which consists of one member of each of the boards of selectmen of our 27 towns, said, can you come up with a better option? Can you build a better mousetrap? And so I spent about 7 months doing some research. I went to the private sector to see what they were doing. And what's interesting is the private sector, and on the West Coast, they had created something called a multi-employer trust for public entities. And so I thought to myself, this is a fairly good option. It's created similar to a pool of investments. It's a number of communities joining together, pooling their resources, driving down the fees, and effectuating economies of scale. So I interviewed a number of agencies that administered those trusts. We interviewed and signed up with PARS, Public Agency Retirement Services. And on January 15, 2015, the Plymouth County Commissioners voted to create the Plymouth County OPEB Trust, which is now called PCOT. And it was the first multi-employer trust of public entities on the East Coast.
Okay.
So we are ahead of the curve.
You are?
Yes.
Okay.
And so what this allows is a community to join our trust, which meets all federal and state guidelines, to invest their monies in a pooled resource, driving down fees and getting the same rate of return, actually a little better rate of return than what they could get if they joined the state.
And how many have joined so far?
So it's interesting. Excellent question. What we were hoping is in the first year, we'd have 5 groups and maybe $1 million in assets. By year 2, we were hoping to have 10 groups and maybe $2.5–3 million in assets.
By groups, you're meaning towns?
Municipalities. Governmental entities, because it could be a school district.
Okay.
So any governmental entity. However, we just finished our second year. We have 25 members.
Wow.
And we have $5.9 million in assets under management.
Fantastic.
What's really exciting is the town of Weymouth just joined 2 weeks ago the Plymouth County OPEB Trust. So they're our 25th member, and they're bringing in another $3.2 million.
Huge.
They're big.
Yeah,
they're big.
huge.
So it's not just for small governmental entities, it's for big governmental entities as well. In our first year, our rates of return have exceeded that at the state level. And in fact, over the last year, from March 1st to March 31st, over that year period of time, we returned 11.5%. Wow. So it has been a good investment. These communities and municipalities that have joined are thrilled.
Of course they are.
We go out and we're interviewing with 2 or 3 every week to see if they're interested in joining. What happened when we created it for Plymouth County, the other treasurers in Barnstable County, Bristol County, and Norfolk County asked if we would open it up to any governmental entities in those 3 counties. And so when the commissioners voted to create it, we made sure that it included Barnstable, Norfolk, Bristol County as well.
I mean, it's a hybrid that's really working, right?
We didn't want to go beyond that geographic area
yet,
because then it creates a lot of travel time for the Plymouth County Treasurer.
Right. And we don't want that.
And we wanted to make sure it was geographic centric. We were excited, however, at some of the first folks that joined. The town of Plainville was one of the early adopters of PCOT, and that was exciting to us because Plainville is getting what source of revenue that they're now dedicating to their OPEB liability? They're getting the casino revenue.
Oh, right.
So that is now, all that revenue is being dedicated to their OPEB liability and is coming into this. So it's really creative, it's exciting. Communities are learning about it. They're thinking, it doesn't really make sense for us to do it on our own because you have to hire a legal team, you have to have financial advisors.
You're doing the one-stop shopping for them.
It's a turnkey operation.
You've done everything.
It really is.
So just in our last 30 seconds, the difference between this, which is for municipalities and people who work for municipalities, and the private sector, we can look forward to going Medicaid, Medicare for our health insurance when we retire. Whereas the people that work for municipalities do not, is that correct?
Not entirely. People that work for municipalities also have to go on Medicare when they hit 65.
Okay.
But then they get supplemental plans.
Sure.
And those supplemental plans are covered under this OPEB trust.
Okay.
So it's
that's
a
what you're
supplemental
covering.
plans that we're covering for those that retire. However, we do have employees that retire that are under 65. Their health insurance is also covered under these trusts.
Oh, interesting.
It's fascinating. It's exciting. We're on the cutting edge.
Good for you.
And really, other people are starting to mirror what we're doing in other states. Rhode Island just adopted one as well. So
good for you. You must be very proud.
Well, it's an exciting opportunity. It's a really clever creation, and all we did was look at what was working best in the industry and adopt it here.
Excellent. Thank you, sir.
You're welcome.
We'll have you back again for another interesting episode very soon.
There are exciting things to talk about in the world of finance.